Hello, I am Dr. Praveen Chandra. I am a heart specialist, cardiologist, and I'm the current chairman of cardiology at Medanta Medicity Hospital in Gurugram in Delhi NCR. And I'm glad that I'm here in Arunachal Pradesh today.
Hello, I'm Dr. Mukherjee. I'm a specialist in kidney diseases. What we cover is dialysis, kidney transplant, kidney cancers, prostate, stone diseases, urinary tract infection, in fact, the entire gamut of kidney and the entire genitourinary system. I'm very happy to be here in Itanagar in Arunachal Pradesh.
So, sir, what inspired the Safe Heart Mission initiative and what is its main objective, sir?
So basically, the heart is the most important part of our body, most important organ of the body, which controls the entire body systems. So it is very important to maintain good health of the heart, and the health of the heart starts from the very beginning, which means it is a lifestyle problem, lifestyle changes which one has to do for maintaining the good and the best health of the heart. And those are important lifestyle methods are doing regular exercise, eating balanced food, then controlling your blood pressure. If somebody has blood pressure, it has to be controlled. Then diabetes is also one major factor which contributes towards occurrence of heart disease. So diabetes, if somebody has, he has to control it, get it checked, get regular medicines, and then of course maintaining, reducing stress. Daily stress is also one of the factors which leads to increase in heart problems, increase in heart attacks, and subsequently, serious complications can happen. So lifestyle is one of the most important things which one has to maintain and have a good lifestyle for having a good heart health.
Heart diseases are on the rise in India. What are the most common risk factors you see among patients?
Heart disease is increasing in our country, and of course, there are two, three main reasons for that. One is that metabolic activities like exercise, like good eating habits, has led to increased incidence of diabetes in our country, and diabetes is the commonest cause for occurrence of heart diseases. So that is why we are now having so many patients who are having heart problems, and our genes. It is also said that the genetic composition of our population is so that we have heart disease at a younger age. So many times we see patients having heart attacks at the age of 30 years, 40 years, 50 years, and that is something which we want to prevent and treat early. So first is prevention, and the second is early detection of heart diseases, and exact treatment, exact diagnosis is very, very important. And so, because if you don't do that, then the heart becomes weak, it becomes damaged, and then we cannot do much about it.
What warning signs should people never ignore when it comes to heart health?
So, in heart diseases, the first early signs or early symptoms, I must say, are if somebody has breathlessness on doing activity like walking, like climbing stairs, like doing any regular activities, if they become breathless, they develop chest pain in the center of the chest, which is going towards the neck or going towards the throat and going towards the arms, especially on exertion or on activity on walking. That is a very early sign of development of heart blockages, which can, if not treated at time, lead to a heart attack. So that is one symptom. The second symptom is palpitations, which means that people feel increased heartbeats. The third is sweating. If somebody starts sweating on activity like cold sweats, that is also something which is related to heart. And fourth is increasing breathlessness. Like if somebody develops breathlessness on usual activities, that is also sign of a heart problem. And that is why many times we see that people first go to a lung specialist when they feel breathless, but actually it is a heart problem. So heart diseases have these common symptoms and which should not be ignored.
Okay, sir. Heart and kidney health are closely connected. So, could you explain how one affects the others?
See, over a period of time, we have learned that organs in the body are not in isolation. It's like a parliament.
Yes.
All the organs talk to each other. When you have heart disease, your heart functioning gets affected. That affects the blood flow to the kidney. Then the kidney goes into failure. If you have kidney disease, then you have salt water accumulation. You have toxic metabolites which accumulate in the body, which cause heart failure, atrial fibrillation, coronary artery disease, stroke, atherosclerosis. And this is a vicious loop. One keeps building upon the other. And it is not just heart and the kidney. There are many other organs which are very closely interrelated. When one falls sick, it's like a community spread of an infection. So one falls sick, the other one becomes sick. That makes the first organ sicker.
Kidney disease is often called a silent killer. So, what are some early signs people should watch out for, sir?
Yeah, see, the irony of kidney disease is that there are very few specific signs. There are a lot of symptoms. A person will feel less hungry, he'll go to the gastroenterologist. He'll feel breathless, he'll go to the pulmonologist. He'll have chest discomfort, he'll go to the cardiologist. He'll have seizures, and he'll go to the neurophysician. So there is, other than stones and infection, stones which cause pain and infection which causes burning or fever, rest of the kidney diseases don't have, they are silent killers. That's why. So people we have seen land up with a creatinine of 13, 14, 20 in the emergency on ventilator. That's the first time he has come to know he has a kidney disease. Yes, but there are few general signs and symptoms. Excessive fatigue, loss of appetite, swelling of feet, fall in urine output, increased urine output, passing more urine at night than during the day, nausea and vomiting, being pale, you don't have enough hemoglobin. All these features indicate that there is possible kidney disease.
So, these are common symptoms, but we usually ignore, sir, this.
Absolutely. And also, unfortunately, they are not specific only to the kidney.
Okay.
Right. So, timely evaluation. The good part of kidney evaluation, it's very cheap. All you have to do is a urine examination, which costs less than 50 rupees in most hospitals, and a creatinine, which will cost 100 rupees. If you do that annually, you'll be far, far better off, and you'll be able to catch your kidney disease much earlier.
Can you, sir, tell us the situation of kidney transplantation in India? Are awareness and organ donation improving, sir? Just like that's a general question.
Yeah, it is. See, in India, we are a population of almost 1.2 billion. And with the prevalence of kidney of almost 2% in the population, means every year 1 lakh new people reach dialysis. 1 lakh new people reaching dialysis means 10 to 15 lakh cases of CKD. Only 10% will survive to reach dialysis. Out of this 1 lakh, only 9,000 get transplanted.
Okay.
And it's not economics. It is availability of organs. Because India is driven by living donation. Means somebody donates an organ out of love and affection to his near ones. With the shrinking family size, we do not have families of 10 brothers and 6 sisters anymore. Usually, people are having children late. People have small families, single child. So, donors are no longer available. Earlier, people used to get married at 15, 16. So, even when the child has a kidney failure at 40, the father is maximum 50.
Yes.
But now the parents are 75, 80. So, they are not eligible to donate. What is ironic is 1 lakh patients died of head injury in India every year. They are all potential organ donors. If you manage to encourage cadaveric donation, you will wipe out the waiting list. You will wipe out illegal transplant in the country. See, we want every patient to live, every person in India to live a long and healthy life.
Yes, definitely, sir.
But someday everybody is going to die.
Yes.
Now it is the choice of the person. Are his organs going to be cremated or give life to somebody else? You're not going to carry your organs with you.
Yes.
So when you donate that organ, you continue to live longer.
How important are regular screening and early diagnosis in preventing major cardiac arrests?
So, if we have to protect our society and protect our people from occurrence of early heart diseases, as I said already, lifestyle modification has to be done. And in checkups, regular blood pressure checkup any person who is above the age of 25 or 30 years must have a BP checkup once in a year, must have a blood sugar checkup once in 5 years. Once in 5 years, they should also have a cholesterol checkup, which is known as lipid profile checkup. And if everything is okay, then there is no problem. But if somebody has any of these which is abnormal, it should be treated at the right time early on. Because many times people feel that I do not want to take medicine for blood pressure, I do not want to take medicine for sugar or diabetes. That is something which is very, very detrimental for the heart, and we have to start treatment or prevention very, very early. Then we can protect our heart.
See, most of the patients are travel people, peer dialysis.
Hmm.
So, could you clarify its role and when it becomes necessary for
Yes.
public information?
See, dialysis is, you're very right. People are very scared of the word
Yes.
dialysis for two reasons. One is a lot of misinformation about the dialysis. Second is people are not aware dialysis technology has changed over the years. Dialysis is not a hindrance to your life, it allows you to continue living. Now, amongst all the organs in the body, we don't have artificial brain,
Yes.
we don't have artificial liver, we don't have artificial intestine, eye. The only organ where we have an artificial kidney is the kidney renal system. And the dialysis machine is an artificial kidney. What your kidneys can't do, it does it for you. So, if you don't do dialysis, you will not live. Dialysis today allows you to live for 15, 20, 30, 35 years with normal function. I have patients who go on cruise, they travel the world. The dialysis technology has changed so much that today dialysis is painless, stress free, and gives very long and good quality of life. Whatever is available anywhere in the world as a dialysis technology is available in India. It's no longer that we have to go to the West. In fact, we have people flying in from the West to get treatment here. The latest form of dialysis technology, high flux dialysis, middle flux dialysis, high cutoff dialyzers, hemodiafiltration, CRRT, CVVHD, everything is available in India across the country. It's not even that you have to travel only to Delhi and Bombay to get that kind of therapy. We have phenomenal quality of dialysis. The same equipment which you will find in Germany, in Australia, in US, in Canada is the same equipment which is being used in Indian dialysis centers. So we are actually giving state of the art therapy at a fraction of the cost. One dialysis session in the United States costs $1,000. That is almost 80,000 rupees. In India, in the best of centers, is just 4,000 or 5,000 rupees.
So recently, the government of Arunachal Pradesh has recently introduced kidney transplant facilities at dreams. How do you see this step benefiting patients in the state, and what further support is needed? I mean,
See, a kidney transplant
Yes.
is the ultimate form of therapy in kidney disease. The moment you get a kidney transplant, you're off dialysis. You go back to as a productive member of the community. You can go back to work. You can support your family. You can continue your education. So it's a very, very important step.
Okay.
And establishing a kidney transplant center within the state is a very important process, because at least basic limited forms of transplant definitely can be there. Complicated transplant, second transplant, of course, they'll need to go to higher centers in major cities, but at least the basic infrastructure and the availability of higher modes of therapy will definitely benefit the population.
So this question is both for you. How can community-based organizations, local NGOs, and government initiatives in Arunachal collaborate with missions like Safe Heart Mission?
So, as I said already, that these collaborative, activities between the society, between the government, between the healthcare providers are very, very important. And they start from education, then providing adequate care, and then, of course, providing the final best type of care which is required for complicated patients. So that is why, from the very beginning, if people know how to avoid heart problems, how to keep the heart healthy is one step. The second is early diagnosis and treatment, like availability of angiography centers, availability of angioplasty, availability of echocardiography, which is a very important test for detection of heart problems, and then subsequently further tests like CT scan, like bypass surgery, etc., can be done in this way.
So, sir, last question is, what message would you like to give specifically to the people of Arunachal Pradesh about protecting their heart and kidney health?
First is awareness. If you're aware that you may be getting these diseases earlier, you no longer get these diseases at 60 or 70. Now you start getting these diseases at 30 years of age.
Yes.
And the awareness of a healthy lifestyle. You see, it's much easier to go and eat a burger or a pizza than to cook healthy food. It's much easier to play a video game and then go and play badminton or squash. Avoidance of sedentary lifestyles. So awareness is first. When you're aware of what you need to do, you will get yourself evaluated in time, you'll get yourself tested in time, and you'll get yourself treated in time. If you get yourself treated in time, there is no irreversible damage to your organs. And the earlier you treat, the more organ you benefit. It's like you don't wait for your entire house to collapse from seepage. You try to treat the seepage at the earliest and you look for it. So the kind of effort you put into your possessions, put it for your own body.
So as we are talking about, awareness is one of the most important things, and the second is treatment at the right time for the right person. It is very, very important, because sometimes patients have diseases inside and they are not getting it treated, they are delaying the treatment. So delaying treatment is denying treatment. So we should not deny our important organs of the body from early treatment, because if we don't treat in time, the organs will get damaged. They will become weak. If somebody has, for example, already developed a heart attack, even if I do angioplasty, the heart will not be so healthy. But if I do the angioplasty before the heart attack has happened, his heart will be absolutely normal. So, early diagnosis, early detection, and early treatment is the key to success.
Thank you, sir.